So today I want to go over with you an amazing case that we've been working on. This patient came to us about 6 months ago, and they were having problems with vertigo. They couldn't get out of their home in terms of being able to live their life. They weren't able to work. They'd been on disability for over a year, and they were scared to wind up going anywhere because they were afraid that they'd have a vertigo episode. Now, if you or someone you know is going through this, please make sure you pass this along, because I want to talk with you about what they did, where they are, and where they are right now, because I'm so excited about this. So this gentleman came to us, and he was really reserved. He was really scared. He didn't know what to do because he had been through his medical doctor. He had had MRIs. He had been to health services in our community, and he just wasn't getting any help, and he was actually getting worse. He had had episodes of vertigo when he was out and was unable to get home and was really, really scared to go anywhere. We immediately took him through our three-dimensional biostructural analysis, and we found that there were some changes in his neck and his lower back that were causing tension on his spinal cord. When we looked at his spine, which should look like this, particularly in his neck, he looked like this. It was straightened and even reversed at one segment. In working with him, we did really gentle adjustments to wind up freeing up the brain stem and top of his neck. We also did some cold laser therapy to reduce inflammation in his neck and his brain stem to help reduce the inflammation and allow his body to start healing. Within a couple of weeks, he wound up having confidence to make it into the office for all of his visits, multiple times a week. And within a few months, he was able to start doing some exercises that we assign and what we call mechanical traction. And that, in addition to the adjustment, has helped his spine to go from straightened and reversed in some segments to a beginning of a curve. Now, he's not fully out of the wood and back to health, but here's the coolest part. Since we've been working with him, he's been able to go out to the supermarket as well as to spend time with family. How cool is that? He also has been able to return to work. Now, he works out in the field and is a surveyor, so he can constantly be exposed to elements, heights, and unstable surfaces. And I'm so excited to say that last week, he spent the week in the field doing surveying, which is his job and his passion, and he's so excited about it. Now, this is someone who's really excited about where he's come. He knows that he's got more work to do to help stabilize his spine more so that his head can be balanced and his body can work best for him. You too can have that same experience, but it takes work and it takes time and it takes the right corrective chiropractor. If you know somebody who's going through this, can you share this with them so that they can understand that there's hope, there's opportunity, and there's a place that can wind up helping them? If it's you yourself that's going through it, let's connect on a discovery call to figure out what's your next best step to getting back to life. Once again, my name is Dr. Greg, and I want to thank you for letting me be a part of your health.